ยายจ๋าหนูอยากไปโรงเรียนยายจ๋าพ่อกับแม่หนูอยู่ไหน
Before 2002, getting infected with HIV for ties was comparable to a death sentence. Almost everyone who had AIDS would die soon after. Each year, over 50,000 to 60,000 died from AIDS before getting access to antiretroviral therapy, or ART. In 2001, only 3,000 out of 650,000 people living with HIV/AIDS got ART.
ในระยะแรกต้องถือว่าเป็นระยะยุคมืดเพราะว่าคนไข้เนี่ยไม่สามารถจะรู้เลยว่าจะมียารักษาหรือเปล่า
Thai's perception of HIV/AIDS is that it is infectious disease. There is no cure, causes a severe problem of stigma and discrimination. PLHA were discouraged to disclose their HIV status to get ART service in hospitals. They just sought any kind of treatments according to their misbeliefs, which caused them severe and painful illnesses, despair, and death. Most of PLHA were male and of working age. Severe chronic illnesses or the loss of head of families left behind orphans and elderly people who could not earn their own living. My husband and I sought all over the place for any treatment, eat anything they suggested, but there was no cure. My illness worsened. I had tuberculosis and fungus in my brain. My husband got pneumonia. We went to the hospital. We sold all that we had, the car, the house, to cover the treatment costs. Finally, we were homeless and collect garbage for a living. The impact of the stigma caused many patients to come and live at the PLHA club. Some brought their children as well. Many patients could not take care of themselves, and there was not enough food and a lot of expenses.
During hard times, we helped each other like families. Some contributed small amounts of money, some took care of their friends.
Seeing the potential of PLHA, the Department of Disease Control therefore initiated the project, a people-centered approach on expanding ART services with close partnerships of the PLHA network and civil society. The empowerment aim of PLHA is to be co-provided. The pilot project was carried out in Chonburi province where the situation was serious. Chonburi Regional Hospital served as a site for model development of ART services. Joining the peer group, I received care and assistance from friends. I did not feel lonely and gained mental support and my health again. It was just like death and rebirth. I want to help others who are facing the same fate. Therefore, I volunteered to be a PLHA leader.
จริงๆเขามีความสำคัญมากในเรื่องของการช่วยให้คำปรึกษาหลังจากที่เราคุยกับแพทย์หรือคุณพยาบาลแล้วเนี่ยบางครั้งเนี่ยเขาต้องการเพื่อนที่มีประสบการณ์คล้ายๆกันนะคะซึ่งมีทุกข์เหมือนกันตอนเกิดทุกข์ใหม่ๆทำอย่างไรทำยังไงถึงยืนได้อย่างมีคุณภาพชีวิตที่ดีแบบนี้นะคะ
PLHA leaders were trained to gain confidence on knowledge and skills needed, such as health, mental support, provision of ART services, counseling skills, and PLHA's household visits. They learned to emphasize the compliance with the drug regimen. Understanding the context of the problems and needs, PLHA leaders were trusted by their peers. It was found that PLHA patients receiving house visits by PLHA leaders had better drug compliance than those who did not. Being a PLHA leader, I have assisted many PLHA. Some stopped their suicidal intentions. The hopeless patients turned to believe in modern treatment with ARV and gained courage to accept the service. They finally survived and lived their normal life. It's hard work. We are tired but happy.
อันหนึ่งที่อาสาสมัครนะคะช่วยเรามากเลยก็คือตอนนี้เรามีเรื่องของการออกไปเชิงรุกในเรื่องของการให้บริการข้างนอกนะคะก็เขาไม่ได้ไปคนเดียวเข้าไปร่วมกับทีมสาขาของโรงพยาบาลถือว่าเป็นส่วนหนึ่งของโรงพยาบาล
In 2002, the Ministry of Public Health, MOPH, by the Department of Disease Control, DDC, empowered the civil society together with the PLHA network to help with planning and strengthening the ART services. DDC also provided financial support to expand the activities for co-delivery of ART service to cover other areas of the country at all levels. The strong contribution of the networks had supported the national authorities' decision to produce locally made ARV that helped to bring down the price of the drug from 6,000 baht to 1,500 baht per month.
ปัจจุบันประเทศไทยมีผู้ติดเชื้อ HIV ซึ่งได้รับการรักษากว่า 300,000 ราย
With the evidence of strong involvement of government, civil society, and PLHA nationwide, the prevention and response to the AIDS problem would be sustained. Thailand therefore commit all efforts on ending AIDS by the year 2030 as the targeted